Gentleman yields back to the gentlelady from Virginia. You want to yield back, or do you have time?
Thank you, Mr. Chair. I would just remind our colleagues that if the trigger laws are triggered by cuts to Medicaid, which I don't see how we get to $880 billion without, that's going to have an impact on our state budgets. That's going to close hospitals, particularly in rural areas. And hundreds of thousands of people in Virginia alone are going to lose their health care. And I was in the state legislature when we expanded Medicaid, and it was a bipartisan vote because Republicans in the state legislature understood that their constituents needed health care, that their constituents needed their hospitals to stay open, and that their constituents were counting on them to ensure they had health care coverage. And any action that this committee or any other committee takes that rips health care away from 80 million Americans, or even just the expansion states, we should have an oversight hearing to determine what's the ripple effect on those states and their populations and their access to care. And we shirk our responsibility as members of this body in a federal-state partnership if we don't do that. And so I think we need to include in our oversight plan something that shows we recognize our responsibility, not just to our constituents, but our state government partners, because we're about to blow a hole in their budget that they're going to not be able to fill. With that, I yield back.